8 consecutive weeks of a fast-moving surge, new COVID-19 cases in Africa have slowed down. That's according to new data from the World Health Organization. The WHO says this is driven by a sharp drop in South Africa, which accounts for the bulk of the continent's reported cases, although this development may be short-lived.
WHO shows new case numbers in Africa fell by 1.7% to nearly 282,000 in the week ending 18 July. Yet removing data from South Africa, which accounts for 37% of these cases, reveals a unique, steep and unbroken 9-week surge. The current peak is 80% higher than Africa's previous peak when data from South Africa is excluded. Without the data from South Africa, cases rose in Africa by 18% to over 182,000 in the week ending on July 18th. 21 African countries have seen cases rise by over 20% for at least 2 weeks running, which is an increase of 3 countries over the previous week. And the highly transmissible Delta variant has been found in 26 African countries. The Alpha variant is in 38 countries and Beta is in 35. South Africa's gains remain uncertain as protests have disrupted the country's response, including disease surveillance and testing. Violent mass gatherings could also trigger another rise in cases. This comes as WHO urges African countries to urgently wrap up COVID-19 vaccinations as the squeeze on vaccine shipments eases. Around 60 million doses are set to arrive in the coming weeks from the United States and Team Europe. The United Kingdom purchased doses and other partners through the COVAX facility. Over 500 million doses are expected through COVAX alone this year.
Dr. Mary Stephen, the Technical Officer for the World Health Organization Regional Office, joins us now via Zoom to bring us up to speed with some more information. Dr. Stephen, a very good evening to you. Thank you so much for joining us. Welcome to the Globe.
Thank you for having me. Good evening.
Indeed. Now, 21 African countries, Dr. Stephen, have seen cases rise by over 20% for at least 2 weeks running. Does it mean that the worst is still to come to Africa?
Thank you. Yes, the outbreak continues to evolve on the continent as we are seeing increase in number of cases in some countries while some countries are stabilizing. The decrease in the cases that we saw in the previous week was driven by the decrease in South Africa. But removing South Africa from the data, you will see that quite a number of countries continue to report increase in number of cases. So the risk really remains very high on the continent, and we have to be alert and continue to ramp up capacities for response.
Now, Dr. Stephen, let's look at South Africa, which accounts for the bulk of the continent's reported cases. I mean, the country has seen violent mass gatherings, which raises fears that there could be, it could trigger another rise in cases, isn't it?
Yes, so there is a possibility any type of mass gathering could trigger increase in number of COVID cases, especially where the preventive measures are not observed. If the population is not observing the preventive measures of wearing the face masks, keeping their distance away, and ensuring hand hygiene, and making sure that whatever form of gathering is happening outdoors, the risks of increasing number of COVID cases is high, especially with the Delta variant that is very, very transmissible.
Yeah, and the highly transmissible Delta variant has been found in 26 African countries. So what's the likelihood that the actual rates are likely even higher, given that many of the affected countries have positive test rates near or above 15%?
And so the testing rates in most of our countries are still not optimal. So the possibility of underreporting is still there, but we have an indicator that we cross-check in addition to the testing capacity is how the bed occupancy is evolving in countries. So if you suddenly begin to see increase in number of admissions, people that will require ICU beds, it means that there are a lot more community that are not being dictated. So countries must continue to monitor both through the surveillance and as well as the hospitals where cases are evolving so that we will continue to ramp up and anticipate this increase in number of cases.
We've seen some parts of the world seemingly turning the page on this pandemic, but here in Africa we are struggling. Why is it? Why is Africa struggling with this pandemic?
Yeah, it's a number of factors. I want to start with the vaccination coverage we have on the continent. If you look at what we have so far, we're covering just about 1.5% that are fully vaccinated on the continent, compared to the high-income countries where majority of them have vaccinated over 50% of their population. You can see that we are still lagging behind. Secondly, the relaxation of the lockdown measures in most countries to reopen the economy facilitated some of these increase in number of cases. And now we are talking about Delta variant. Initially, we talked about the statistics, of course, we have the Alpha variant, we have the Beta variant, we have the Delta variant, all circulating. So a cocktail of variants that are more transmissible than the original COVID-19 virus is spreading wide across the continent. So this is also contributing. And lastly, the preventive measures by the general population. Because of the pandemic fatigue, a lot of people are now relaxed, no longer wearing their face masks as it used to be at the beginning of this pandemic. But we need to make sure that we continue to observe the preventive measures, ramp up capacity for response as we continue to mobilize more vaccines.
And I suppose, Dr. Stevens, this brings us to the discussion of vaccine inequality. How much power, if at all, does the World Health Organization have in terms of dismantling vaccine nationalism and hoarding of vaccine by the wealthy countries?
This is an interesting question. The issue of vaccination and the sovereignty of countries. We don't have the power to take away the sovereignty of countries, let me put it this way, but we continue to push. And this was the reason why the COVAX facility in the first place came up, because of the previous experience from pandemics where the countries in low and middle income were left behind with regards to vaccination. So to address that was why the COVAX came about, so that we can increase equity for vaccination. Right now, we are still lagging behind with regards to the vaccine coverage, but of course, in the coming weeks, we are expecting over 60 million doses on the continent, which is a very good development. And we need to continue to advocate for this. Vaccine sharing is very, very important. We can see that countries are beginning to respond, the European countries, the United States of America, and we encourage many more countries to participate through the COVAX facility and share those doses to countries in Africa.
Now, other variants like the Alpha variant is in 38 countries and Beta variant, as a case in point, is in 35 countries. So there's even talk of a possible fourth wave here in Africa. So are the African countries prepared if we reach this so-called fourth wave? Preparation
is a continuous process, and all countries, not just in Africa, must continue to prepare for unforeseen challenges, because as long as the outbreak continues to evolve, and especially for us in Africa where our vaccination coverage is still very, very low, we have to anticipate that we can move from third wave to fourth wave and even many more waves as we continue or we struggle to cover at least 70% of the population for the herd immunity. So with this, the risk is still very, very high. And we have to continue to ramp up the capacity, both for the control as well as the preventive measures by the general population. Yes, we are tired, but the outbreak is not over. We need to make sure that we are very, very vigilant until we see the end of this outbreak.
And we understand that about 800 people in Uganda received fake COVID-19 vaccines last month from unapproved people. If this is true, this might be a devastating blow for the WHO's, COVID-19 fighting efforts.
Okay, so it's a sad development if the story is true for people to receive fake vaccine, but the general population need to be alert. Most countries in Africa have specific government facility where you can take COVID-19 vaccine. So we need to shy away or move away from this pressure of getting vaccinated by all means, going to all these private facilities. I would like to call on the general population, make sure you're going to government-approved facility to take your vaccine, to avoid all this issue of fake vaccination circulating around.
Now, the agreement which paves the way for the Pfizer COVID-19 vaccine to be manufactured on the continent surely is a groundbreaker. So is this an indication that we will be out of the woods much sooner than we anticipated?
This is definitely a right step in the right direction. Definitely it puts Africa in a better place to get more access to vaccine doses. And this for the COVID-19 pandemic, even for future outbreak, we are going to use this capacity to respond. So it's a very, very good development, a very good way forward, and let's continue to build on it. Continue to have many more countries in Africa with the capacity to develop this vaccine. This will help us in building back for future outbreak as well.
Now, the Cape Town-based BioVac will process and distribute over 100 million vaccine doses a year for the African Union beginning next year. So has WHO Africa Division estimated how many vaccine doses does Africa need to sort out its people?
So initially in April, when the Director General of WHO made a call to all countries to cover their population, the most vulnerable, at least 10% by September and 30% by December 2021. So we made that estimation. For the 10%, the continent will require about 220 million doses. And for the 30% by December 2021, we will require over 700 million doses to cover this population. So you can extrapolate from this. But as we continue to ramp up the vaccine coverage and get more access to vaccine, countries need to continue to expand the capacity to absorb this vaccine as well and address the issue of hesitancy.
What do you make of the surveillance in Africa in particular being limited?
Okay, surveillance in Africa is not new. We have been implementing surveillance for decades on the continent. I think the main challenge here is the testing capacity, basically, where the resources is not adequate, especially at the subnational level, to pick up these cases. So we call on countries in Africa, of course, continue to expand the capacities, and even the surveillance, they can expand to community surveillance. So we will continue to ramp up. There is always opportunity and opportunity to improve on what we currently have.
How do we deal with the mutation of a particular virus? Because there is a worry that we'll keep on, fighting this mutation or new variants as we move along.
Okay, so the answer for me is very, very simple. Viruses will mutate as they continue to circulate among human populations. So what we need to focus on is to make sure that we are ramping up our preparedness and preventive measures. Because the virus, they spread through human vehicles. Human beings are the ones that carry them. And once they continue to interact, the virus will spread. And especially when it mutates, it comes up with a more virulent strain that is highly transmissible, then it becomes easier for the spread to happen. So what we need, basically prevention, is the key here. Ensuring that people are wearing their face masks, avoiding unnecessary mass gathering, keeping your distance away. If you must meet at outdoor spaces. So with this, it will go in a very, very long way in reducing the spread of the virus among the human population.
Okay. Dr. Mary Stephen, Technical Officer for the World Health Organization Africa Regional Office, thank you so much for your time.
Thank you.